She almost seemed like she was possessed.
Welcome to Diagnose This, where future doctors come to think differently so you don't miss what others did. In this series, you'll explore real patient cases that stumped even experienced physicians. As you watch, focus on how the patient is described. Remember, on your exams, you won't see the patient, you'll read the vignette. So train your mind to visualize, connect the dots, and think clinically. Grab your notes, sharpen your instincts, and let's see if you can diagnose this.
Jenny and Ray Moyer were ecstatic when their daughter Daphne was born in October of 2003.
It was a very emotional experience. I remember crying, which surprised me.
Ray had a baby about 15 years before Daphne was born, who was born premature, and she passed away from complications from the prematurity.
Having Daphne was absolutely another shot at fatherhood. She certainly felt special.
Everything seems perfect when they leave the hospital, but once Ray and Jenny bring Daphne home, she's inconsolable.
Carrying her and patting her wouldn't help. She might settle down for a little while, but just go into her screaming again. One day, Daphne cried for about 12 hours.
I wasn't overly concerned. Compared to the history I had with my previous daughter, this seemed like a small bump in the road.
But I did always know that there was something more than just what other babies go through.
Then, when Daphne is 3 months old, Jenny and her mother look on in shock as the infant goes through a fleeting but bizarre episode.
We were both in the kitchen, and I had Daphne on my lap and was feeding her.
All of a sudden, her eyes started going back and forth.
And it was just a couple of seconds, and it was, whoa, what was that?
Jenny got the video camera and videotaped it.
I wanted to make sure that the doctors could see this happening. She would have like a spurt where her eyes would go back and forth for a couple of seconds, and maybe a fraction of a second later they would start again.
We were totally freaked out. We took her to the emergency room right away. Nobody at the ER wanted to watch the video because whenever they would check in on Daphne, she was just laying there and was perfectly normal. If she did have one of the eye movements, by the time we would call somebody to look, it would be over with.
When a neurologist finally examines Daphne, he doesn't think there's anything to be concerned about.
We had to really persuade him to look at that video, and when he did, he still was not moved by it. His explanation was that it was some pre-migraine activity. He told us we could go home.
I was a little disgusted and said, so what are we supposed to do? Just ignore, the baby's eyes rolling out of her head? But we were just given a pat and sent home.
But over the next few days, these strange episodes happen more frequently and begin to affect Daphne's entire body.
Her eyes would go back and forth, and at the same time, she would stiffen out.
And then she'd scream and cry, and the next one would come. She almost seemed like she was possessed.
It was frightening, and it was at that time that I knew that something was seriously wrong with Daphne.
Jenny and Ray start to question the pre-migraine activity diagnosis. Determined to find out what's happening to her daughter, Jenny begins researching Daphne's symptoms on her own.
I just would get on my computer and spend hours and hours typing in eye movement back and forth and arm extensions, seeing what I could come up with.
What Jenny discovers is frightening.
The answer came in a film clip that another parent sent of their child. In the clip, the young boy was doing exactly what Daphne was doing. I mean, exactly.
Jenny and Ray are convinced that Daphne has been suffering from infantile spasms, a form of epilepsy often associated with mental retardation and developmental delay.
At first, the two words together sound pretty innocent, but then I read that it was considered a cataclysmic seizure disorder that didn't respond well to medicines.
Terrified, Jenny and Ray rushed Daphne to the ER.
This neurologist came in and saw Daphne having an episode, and he was as convinced as we were that it was infantile spasms. Ray just broke down and started crying. He told the neurologist that he had a daughter from a previous marriage who passed away.
It seemed like a continuation of a nightmare.
Over the next few weeks, the neurologist prescribes a series of anti-seizure medications. Some have devastating side effects, others simply don't work, and Daphne's seizures are getting worse.
The episodes were occurring 20 to as many as 30 times a day, up to 10 minutes at a time.
With each new episode, Jenny and Ray feel like they're slowly losing their daughter.
She seemed to be going away. She seemed to almost be moving towards a catatonic state.
When she was 8 months old, while other babies are starting to learn to crawl and eating pureed foods in a high chair, Daphne was still like a 2-month-old. She just kind of looked to the left and gazed off into nowhere.
She stopped being able to drink a bottle. She had to be given a feeding tube.
I just didn't understand what was going on and how could this be happening to my little girl.
Finally, after agonizing months of trying different medications and watching their little baby succumb to seizure after seizure, Jenny and Ray find a drug that works.
Daphne was seizure-free after her first dose of the new medication. It was a miracle.
She went from sleeping all day to never wanting to take a nap. She would take her rattle and look at the little beads inside as she twisted it around. She really started connecting again.
Can you say hi?
Hi, Daphne.
Is she not the cutest thing?
But the relief doesn't last.
Daphne had 5 months of great development and seemed to be making progress, and then when she was 15 months old, she had her first stroke.
15-month-old Daphne Moyer has been suffering from terrible seizures and severe developmental delays. 5 months earlier, her parents finally found a drug that seemed to work. But just when they think their little girl is getting better, the unimaginable happens.
She had been very irritable all day, and later in the afternoon, my mom noticed that she was holding her arm funny.
I said, Jenny, come look at her arm. She doesn't seem like she's moving it. She puts her down on a blanket on the floor and starts checking her.
I tried to get her to move her arm and noticed she was only using her right arm instead of her left.
Then she feels her leg and feels the tremors in her legs and rushes to the phone and calls the hospital right away.
Jenny and her mother rush Daphne to the ER.
We were terrified and were trying not to think the unthinkable. She was taken to CAT scan, and an hour later the neurologist came in and explained to us that Daphne had a stroke and added that it was a significant stroke.
When the doctor explained to us what happened, life just stopped.
The neurologist drew a picture of what they saw in Daphne's MRI. He showed the arteries running up to Daphne's brain. He colored out a little portion to show that it was blocked off. He began to explain to us that Daphne had an unusual finding on her MRI that was called moya-moya disease.
In moya-moya disease, the main vessels that supply the brain with blood become blocked off. Daphne's brain had been starving for blood, which was causing her seizures and stroke. The word moya-moya is Japanese for puff of smoke, which refers to the appearance of tiny abnormal blood vessels that can be seen on the patient's brain scans. Doctors don't know what causes this extremely rare disease, but left untreated, it leads to neurological damage and can be fatal.
It was just devastating, just absolutely devastating.
The only treatment for moya-moya is surgery, but doctors tell Jenny and Ray that Daphne is most likely too weak to survive the risky procedure.
She would continue to have strokes like the one we saw, and it would eventually die.
He gave her a couple weeks at most.
2 days later, Daphne suffers yet another stroke in the hospital.
The night after Daphne had the second stroke, she was just basically paralyzed and could barely even open her eyes to look at us.
We were just hugging each other and holding each other's hand.
We requested that the chaplain of the hospital baptize Daphne.
They made a plaster cast of her hands and her feet, cut some hair for us so that we could remember Daphne later. We just talked about the things that we were going to miss.
Daphne loved to dance in the kitchen and loved to look at trees, and it was just hard to think about not doing those things with her.
We took her home and we had everything set up for the final event. We had all the medicines lined up. We had all the machines brought to the house to make life as comfortable as possible until it was time for Daphne to go. I just don't think that there could be anything more devastating than losing a child.
But she didn't die. She did not die.
She began this miraculous fight back, as she always has. The first thing she did was wiggle her toes and moved her feet and just continued to regain more and more of her functions.
As Daphne shows signs of recovery, Jenny begins to wonder whether her little girl might be a candidate for surgery after all. She contacts a neurosurgeon at Stanford University who specializes in moya-moya disease.
I get several emails from moya-moya patients or their families a week asking if I might be able to help.
At that point, I thought I had nothing to lose by asking them, and even if they said, no, I don't want to touch this patient, I would feel like I had done everything that I could.
Jenny sent Daphne's MR scan and records, and we reviewed them. Although Daphne had already sustained significant strokes, we felt that she had the potential to make a very good recovery. The brain of a 1 or 2 year old has an incredible ability to repair itself and restore function.
Within a week, Dr. Steinberg's office calls. Jenny and Ray are overjoyed to hear that Daphne has been accepted as a surgery candidate.
Even if it was a risk, my goodness, what's a risk of surgery when you've just been told that your daughter's probably going to pass away within a couple of weeks?
In late February of 2005, the family flies to California with 16-month-old Daphne.
We had our eyes open from the beginning about the surgery. We knew that it wasn't a miracle, that it wasn't going to fix the areas in Daphne's brain that had been damaged.
Jenny and Ray are hanging on by a thread as Daphne is prepped for a risky brain surgery that could save her life.
There are always risks involved in brain surgery. If you lost a cup of blood during surgery, that's no big deal to you. But if Daphne, who was this big, loses a cup of blood, she could die.
At 16 months old, Daphne Moyer has been diagnosed with a rare brain disorder called moya-moya disease. The blood vessels leading to her brain are blocked off, and surgery is Daphne's only hope for survival.
Since there's no way of opening up the blocked blood vessels, we provide a new source of blood flow around the blocked blood vessels. It's like what's done for the heart sometimes. We're doing the same thing with the brain. Bypass surgery doesn't undo the damage that's already been done. Our job is to prevent future worsening from new strokes.
I knew the minute I saw Dr. Steinberg walking down the hallway that things had gone well. He walked with his head up and a smile on his face. His exact words were, "Daphne behaved herself."
I just let the air out of my lungs. I just took a big, deep breath and said, we've overcome the last hurdle.
6 months after Ray and Jenny were told that Daphne would die, they're celebrating her second birthday.
Daphne has made a great recovery. She is able to do almost everything she could do before her stroke. She moves both arms, she moves both legs, she smiles at us, she interacts with us. So she's just a blessing.
It remains to be seen how much damage Daphne's brain has suffered, but Dr. Steinberg is optimistic.
We've seen quite remarkable improvement in the last 6 months. The bypass arteries have now grown in a very luxurious blood supply to both sides of her brain. The young brain can recover in ways that an adult brain cannot recover.
It won't matter if she doesn't develop to the full potential of a normal person, as long as she's happy. That's all we ever care about.
Moya Moya occurs in only 1 in a million people. Ray and Jenny feel lucky that Daphne was diagnosed at all.
Most pediatricians are not used to recognizing the Moya Moya disease in a 16-month-old. It is rare. It's not seen even by a lot of neurologists or neurosurgeons.
Daphne has taught me not to take what doctors say at face value. They don't know your child as well as you do. So you just have to go with what you feel and do your own research and try to keep finding the right person to help your child. That's why we have Daphne today.
All right. How did you do? Drop a comment below and let us know. At what point did you first suspect the diagnosis? What were the key clues that tipped you off? If you didn't get it, don't worry. Even experienced physicians have missed these rare or tricky cases. Although they missed it, you won't. This is where future doctors come to think differently. If you need help to build strong, personalized systems for USMLE success, check out USMLE Step. We've got the structure, support, and strategy you need to turn clinical clues into exam confidence. Like and be sure to subscribe if you'd like more content like this.